Here we are at the fantastic PwC rooms at the top of Sydney, overlooking the most beautiful, glorious city in the world, and we're here for the AI Med breakfast briefing. Of course, AI Med is launching in November, coming to Sydney for the first time ever, and we have one of the speakers with me today, Talat, Dr. Talat. Thank you so much for joining us today.
Thank you, Alexi.
Now, you're here to speak, and
Yes.
You're going to be delivering a little bit of knowledge, which is wonderful for the audience. Tell us what you're going to be speaking on today.
So, Alexi, I will be talking about is a GPS type project for pregnancy the way of the future? And the reason I selected that particular topic is that pregnancy is such an exciting and interesting time in a woman's life, and the healthcare in Australia can be quite fragmented at times. And is it possible for us to use the platform of technology as an add-on, so not really replacing any of her clinical care, but actually adding on to the existing care that she's getting, but to actually empower women and create some consistency of information delivery, create some more robust way of analyzing the diagnostic tools that we already have existing for their journey? And can we create some more regular prompts, or perhaps some integration of electronic record systems, so that the clinicians are not spending time actually chasing documentation or trying to find bits and pieces about her journey. Rather, that is at the fingertips, and the energy and the time of the clinical team is dedicated more to partnering with the woman and providing emotional and the actual medical care.
Because that's what it's about. It's about humanising the experience, and as you said, perfect way to describe it, an add-on. It's to enhance the experience.
Exactly.
One of the things you mentioned there was is there a bit of a disparity in your knowledge with it when it comes to all of the like you said, fragmented, the pieces of data that come around the journey of pregnancy? Do you find that in your role as a clinician?
Yes, we do, because the thing is that it's a 9-month journey, and it's a snapshot from her longitudinal care with the general practitioner. So then obviously general practitioners would see the woman early in her pregnancy, then she would often be referred to the hospital or to private obstetric care, depending on what model she chooses, and then midwifery care would get involved, and then obstetric backup would be activated. So there's so many different clinicians and so many touch points in her journey during pregnancy that I feel very strongly that collaborative models of care are the way of the future, that we're moving away from one person only taking care of a particular pregnant woman. And so if we're going to manage as a team and as a functional team, then why not reach out for the most, robust platform that can enable our team to work more functionally?
And of course, the journey of pregnancy is a classic example where you have, the beginning, the very first discovery, and it's also joyous as well.
That's right.
We want to maintain that joy throughout the experience, even if it does become negative. And is that where the human element becomes quite important?
That's
if
exactly right.
things do take a wrong turn.
Very good point, Alexi. That although for a large part it is very joyous, like you've rightly said, but unfortunately there are very tragic scenarios with loss or certain situations in which, like you rightly said, things don't go as planned or as hoped. And those are the scenarios I think even more that the woman needs, and her family needs, that support and that care of the team around her.
Are you looking forward to the summit in November?
I am very excited about that. I'm really, really looking forward to it.
Thank you for this opportunity. In your experience, is it a first? Is it the first?
So it is the first time in Australia, and I'm really delighted that something that's quite that has been happening at an international level is now coming to Australia and is giving us, and what I'm also excited about, Alexi, is that it's not just very IT-led, so that there has been a combination of clinicians like myself who may not be, a very high-end IT person at all, but can bring it, so everyone has something unique to bring to that journey. And often we find that at the end, the best products are those that have enough clinicians, the people who are actually at the core phase of the care delivery, if they are integrated into that that model or that project. And so I'm particularly excited because I could see clinicians, a mix of clinicians and IT-based people.
Yes, and it's absolutely a clinician-focused conference, which I think everyone's quite excited about, which we can see from the turnout today. Look, thank you so much for joining us today. We look forward to the summit in November, and thanks for joining Alexi Boyd at the AI Med Breakfast Briefing.
Thank you, Alexi. It's a pleasure.